This is election season, and voters in 10 states will have an opportunity to vote on ballot measures, quite frankly, that would open the door to expanding the killing of unborn babies as late as the third trimester. It's so important that you vote against these measures. Now, some of the measures do even more than that. The 10 states, by the way, are Arizona, Colorado, Florida, Maryland, Missouri, Montana, Nebraska, Nevada, New York, and South Dakota. And we've been covering many of these going into detail. And by the way, we have a Life on the Ballot resource so that you can be informed and your friends can be informed in this fight for life. Now, you can find that at frc.org/life on the ballot, or simply text LIFE to 67742. That's LIFE to 67742. It's interesting, I was looking at some of the polling data out of Arizona, and it was interesting that more men than women plan to support this abortion measure. Now, we'd say, well, maybe that's surprising. Maybe not. You recall we talked about this a number of weeks ago. There was a special online event, I think it was called White Guys for Harris, or White Dudes for Harris. And the Secretary of Transportation, Pete Buttigieg, had this to say.
Of course, men are also more free in a country where we have a president who stands up for things like access to abortion care. Men are more free when the leader of the free world and the leader of this country supports access to birth control and to IVF.
Free to be what? Irresponsible? Well, today, as I said, we're going to take a look at Arizona in greater depth. It's Proposition 139. Joining me now to discuss this is Cathi Herrod, president of the Center for Arizona Policy. Cathi, welcome back to Washington Watch.
Thanks, Tony. Glad to be on with you.
All right, so tell us about Prop 139 and what it would do.
Well, Prop 139 would give every individual, it says every individual, a fundamental right to an abortion in our state constitution. And it further says that government cannot deny, restrict, or interfere with that right. So basically, it would wipe out any laws that provide for women's health and safety, that allow parental consent, that require that a doctor oversees the health care of the woman, or even give her information about whether or not to have the abortion. So it's a very radical amendment in our state constitution. It would not be changeable by the legislature in any way, and it basically would be unrestricted, unregulated abortion in Arizona.
I mean, just as I pointed out a moment ago on the polling data where it shows more men are supportive about this, and that's in keeping with what we're seeing elsewhere, would this not lead to the exploitation of women?
Well, very much so. And one of the worst features or most troubling features of the language is that government could not punish anyone who aids or assists the pregnant individual in getting the abortion. And it says pregnant individual. So that's the sex abuser. That's the human trafficker who's going to coerce the woman into having an abortion. So it totally lets men off the hook, and or even further than that. And then when you think that we know, why do most women seek an abortion? It's because they don't have the support system. They don't have, the father of the child is not there to help. So it's really outrageous when you stop and think about it.
This, as you pointed out, shuts out moms and dads when their minor daughter needs them most. I mean, this drives a wedge between parent and child, more of what we see on the left. But this is also out of step with the voters in Arizona, is it not?
Yes, and in Arizona, it gets overlooked that our current law is that abortion is legal up until 15 weeks. And after 15 weeks, gestational age of the unborn child, the woman can still get the abortion for a medical emergency, and medical emergency is defined very broadly in our law. So while that may not be where we'd like the law to be, that is where the law is, and that's where we are at in Arizona. And so the choice of the voters is you vote no, and you keep a limit of abortions at 15 weeks. You vote yes, and you bring in unrestricted, unregulated abortion that doesn't provide for women or girls, and really makes us just like California, with our abortion law.
So, Cathi Herrod, 90% of Arizona voters support limits on abortion at 15 weeks or earlier. So why do you think this, as I made reference to a New York Times poll, showed support for Prop 139 at 58% of likely voters? What's going on?
Well, polls can be all over the place. We've seen polls. We've seen another New York Times poll that had it at 53%. We've had one at 52%, 51%. So, to me, what's going on is that once voters understand and see what's in Prop 139, they vote no. The main problem are the lies that the other side's putting out.
No,
Of
they're
course, the
not
money that
lying.
they've
They're
got.
not. They're not being dishonest. I mean, people who would advocate for killing unborn children won't tell a lie, would they?
Well, and that it's so frustrating because besides, they've got the media totally on their side in Arizona, but that's why the grassroots effort in Arizona has been absolutely incredible with letting people know the truth about 139 and that it is a no vote.
All right, so we've got about 45 seconds left. What is your encouragement to our viewers and listeners in Arizona?
Well, that we have over 800 pastors that have signed a pro-life declaration, that I get reports every weekend of pastors who are speaking out strongly against Prop 139. The Catholic bishops have spoken out strongly against 139. So for these next 2 weeks, pray, first of all, but also talk to your neighbors, talk to your friends. Itgoestoofar.com is the website. The talking points are on there. Spread the word that it's a no vote and that we can defeat this thing. By God's grace and mercy, 139 can go down in Arizona.
Itgoestoofar.com. That's where people can find the resources about the Arizona ballot initiative. Cathi Herrod, always great to see you. Thank you for the great work you're
Thank
doing
you.
there in Arizona.
Thanks a lot.